All right, this is episode 14 of Ask the Doc. Got a question via email this week from Emily. She asked about, what was it, Brian? Baker's cyst? Baker's cyst in her knee. And the orthopedic doctor told her, you know, the main source of her problem is pain due to the Baker's cyst. So people that don't know what a Baker's cyst is, basically there's a sac behind your knee and it's filled with fluid when you have a knee problem. So a lot of doctors go in there, they drain the knee and tell you you're going to be good to go, but that Baker's cyst keeps coming back. So you have to keep going in and removing the Baker's cyst, but it keeps coming back. The problem was no one figured out why that Baker's cyst is forming in the first place. That's the real problem. When there's fluid or inflammation buildup, all it tells me as a doctor is that something is wrong with the knee. So they keep going in and draining it, but it's not fixing anything. So they always talk about the definition of insanity is doing the same thing over and over and over again. Yes, the Baker's cyst is giving you pain and discomfort, but it's not the real problem. So what you probably have going on is a problem somewhere in the ankle or the hip or even some degeneration in the knee. And when they keep going in and fixing the Baker's cyst, they're not fixing anything. So if you've been told you have a Baker's cyst and you're still having knee problems, maybe it's time to get to a new doctor that can actually figure out what's going on with you biomechanically and fix the problem so you don't have to have that Baker's cyst come back. I've had several patients where we've actually cleaned up their knee mechanics and their Baker's cyst went away on their own and I didn't have to cut them open or give them any drugs or surgery. That's a pretty good option there. So if you're dealing with Baker's cyst and you think that's the real problem, maybe it's time to look a little further down the chain. We'll see you guys next week.